gloves are being worn to protect the wearer primarily, and actually their use reflects a poor knowledge and a lack of competence in risk assessment. Hand hygiene is an emotional response to touching things that are dirty. So of course, if gloves are worn, then that eliminates that emotional trigger, because there isn't that sense that you've touched something dirty. So we have to recognize that we need to actually strengthen this idea that gloves are at greater risk as hands at transmitting infection. We undertook this work through doing a combination of audits and interviews with staff. And the audit showed us that gloves were commonly used by all types of healthcare workers for a wide range of low-risk procedures. About 60% of the times that we saw gloves being worn, they were for procedures where there was no contact with body fluid and no other indication for wearing gloves. In addition, about half the episodes of care where gloves were used resulted in a risk of cross-contamination. So a contravention of a moment of hand hygiene because the gloves were not removed or changed between tasks. And for about 40% of episodes of care where gloves were used, the staff didn't wash their hands after removing the gloves either. We interviewed 25 staff, and we analysed the themes that came out of those interviews and identified that emotion and socialisation were key drivers of this glove use. Emotion was reflected in a sense of fear or disgust at touching things that are perceived to be dirty or unpleasant. They may not present a risk of infection, but they were perceived to be dirty. And gloves also acted as a psychological barrier to avoid touching patients' intimate areas. Socialisation reflected the influence of peers, perception of what was required by IC policy, although often it wasn't actually in the policy, and also the adoption of gloves as a habit, as a routine practice, without really thinking about when they were needed or not. We also established from the interviews that challenging inappropriate behaviour was very difficult, as wearing them was perceived to be a very personal decision, and it wasn't up to other healthcare professionals to challenge their colleagues about wearing gloves inappropriately. Healthcare workers are actually confused by infection control messages. So we say to practitioners, use standard precautions, treat everybody the same. But at the same time, we say for contact precautions, wear gloves for all contact with this patient because they're known to have an infection. So that implies that hand hygiene is ineffective. And it's actually not surprising that staff then move towards wearing gloves really for almost every type of care that they deliver to patients. So how do we change this? Now, the concept in the paper that we've described is applying human factors and ergonomics to improving glove use. Why? Because we know from our work that policy and education are ineffective. The emotional and socio-environmental factors are such strong drivers of this behaviour that just telling people what to do is not going to be enough. We need to explore more widely how we get change to occur. So, for example, a human factors approach needs to address the environment of care. For example, defining appropriate use of gloves and points for hand hygiene, agreeing standards with clinicians and with patients about when gloves are used, and really looking at where gloves are located so that staff can readily access them during the delivery of care, rather than being pushed towards putting them on long before they ever get near the patient.